Hello everyone, Dr. Mark here with you again today, and I wanted to talk about cancer and cancer prevention in Rotties. I do not think dogs that are being treated for cancer or are trying to prevent the development of cancer should be eating ultra-processed dog food. That is all commercial dog foods, as that is all that is available. Dogs with cancer do not need a high-carbohydrate meal that feeds the tumor cells. There are many types of cancer, and all cancer cells grow fast and survive on sugars that are produced by carbohydrates in dry dog foods. Some of the main ingredients of those new cancer foods on the market are corn gluten meal and wheat. It also contains soybean meal, rice, barley, and pecan shells. Products added to these processed diets are proven to damage a dog's health but are used by many companies to reduce the cost of the food. In certain types of cancer, some oncologists now believe that the best thing you can do is give whole food that starves the tumor. There is still not enough evidence that a low-carbohydrate, keto, type diet will help with all of them, but it is an area that is being studied. If your dog is diagnosed with a mast cell cancer, it is more likely to help, but even if your Rottie is diagnosed with lymphoma or osteosarcoma, it is worth trying. No one can tell you for sure that your dog's tumor is going to go away with a better diet. What we can tell you, based on current research into human nutrition, is that the tumor depends on glucose from carbohydrates in the food to survive. Your Rottie's best chance is to reduce the nutrient supply to the cancer. It is not going to get smaller or go away if you give her food that supports the cancer. Switching to a diet that does not feed the tumor may keep it from growing and may even help it to go away. Feeding your Rottweiler in that way, however, is going to take more of your time, and it is not as simple as just opening a bag and dumping a cup of food in a bowl. Even if you find a dry dog food that is labeled keto, it is going to be an ultra-processed food and not what your dog needs. If you take a minute and read the label, you will find many fillers and preservatives added to the food to extend shelf life. Dogs have no requirement for carbohydrates in their food, so the best thing is to feed a whole diet. To make up a keto whole food, you should give your Rottie about 70 to 80% fatty meat. I give my own dogs mostly raw, but some veterinarians do not support the use of raw meat for dogs, so if you choose you can cook the meat. It will not alter the effectiveness of the keto diet. Rotties with mast cell tumors are not more likely to have GI problems than other dogs, but with some types of cancer, dogs are more likely to get infections, and cooked food has fewer bacteria. Just choose whatever cuts are cheapest, since any meat can be used for this portion of the diet. Also give about 10% raw bones. As long as they are not cooked, bones are safe and do not splinter. You can give bones like chicken wings, feet, and necks if available, or sometimes butchers will have cow bones available. If your Rottie has had any of his teeth broken off or cannot eat bones for some reason, you can replace this part of the diet with eggshells or bone meal. Part of his homemade whole food diet should be about 10% organ meats. About half of this should be liver, but you should also give kidneys, spleen, and any other organs to supply the necessary vitamins and minerals. Include eggs. They should be given every day to meet all of your dog's vitamin needs. The research indicates that the vitamins are more available to your dog if they are raw, and the whites are easier to digest if they are cooked, so a poached egg is best. If they are inexpensive in your area, you can add more eggs to the diet. I would give at least 2 a day. Fish is very important in a Rottie with cancer. If you are not able to give fresh or canned fish, an omega-3 fatty acid supplement is important. A medium-sized dog can have canned sardines added a few times a week to the food. They still have the bones in them, so will meet the fatty acid needs and help provide calcium. The maximum dose for a 100-pound Rottie is about 5 cans, but you can give a can without upsetting his bowel and give another can each day if he adapts well. Supplements are worth trying if you can afford the extra costs. There are many cancer supplements on the market, and the problem with recommending them is that there are no studies to show that they work better than dietary change, work with dietary change, or if they work at all. Apicaps have flavonoids that are said to encourage the death of cancer cells. There are many other supplements available, like mushrooms and turmeric powder, but the most important thing is a dietary change. Dogs with cancer may also be absorbing vitamins less than healthy animals, or need more, so a mineral and multivitamin daily supplement may be beneficial. I know it is not easy to go without treats if you have been giving them to your dog his whole life. What you can do is take part of the diet and prepare it as a whole food treat. I take that 5% of the diet that should be provided as liver and cut the liver lobes up into fist-sized chunks. I then cook them for about 15 minutes in my air fryer, and when dried I cut them up into treat-sized chunks. I only do this once a week or so and then freeze the pieces in my freezer so when I want to take one of my dogs out the liver is ready. Mast cell tumors have been shown to decrease in size with dietary change. The owner of the dog in one study decided not to pursue traditional cancer therapy and switched her dog to a vegan diet. The cancer got worse. She then started feeding her dog a high-meat and fat keto-type diet, and the tumor went away. Not all mast cell tumors are the same, and your dog may respond differently to the pet in this study. We do know that some processed dog foods cause cancer. Once your dog has cancer, however, there is still debate on which diet is going to be useful to help your dog. The best advice I can give you is to switch your dog to a whole food diet right away. A low carbohydrate might help your Rottie. There are also new treatments available for metastatic mast cell tumors, so you might want to consult a veterinary oncologist to evaluate some of those options. Thanks for watching. I am going to include some source papers in the details for this video, so if you want to look at them you can find the links there. If you have any questions you can leave it in the comments or go to my Ask a Vet column at yourpetsathome.com. Give this a like if it was helpful. I hope your Rottie does fine, so if you have any questions I can help you with, let me know.